My name is Rachel Campos. I am a family nurse practitioner at West Texas Orthopedics. Iovera is a procedure done in the clinic setting for patients with knee pain, whether they're going to undergo a total knee replacement, and we're doing this to assist with post-op pain. It's also done on patients for chronic knee pain that is just not really responding to other conservative treatments, whether they've had medicines, injections, things like that. This is another tool that we have to assist with knee pain. Candidates for iovera are patients who have knee pain, whether it's a chronic condition that's no longer responding to conservative treatment, that's an option for them. Iovera is also for patients who are going to undergo a knee replacement. We do this prior to their surgery to help with post-op pain. There is also a small patient population who are still having residual pain after having a knee replacement, and iovera can be used for them as well to hopefully help decrease some of the pain that they're still experiencing. Patients can receive iovera treatment every 90 days. We do get insurance approval prior to all of this, and to make sure that insurance is going to cover it, but not necessarily do they have to get it every 90 days. We're finding that patients are getting benefits from the iovera treatment 3, 4, 5 months down the road. Iovera is typically covered by Medicare. That is one of the few insurances that we don't have to get authorization for. We are finding that more and more commercial insurances are covering iovera as well, but it is something that we absolutely check with the patient's insurance prior to scheduling it, so that way the patient understands if they're going to have any type of out-of-pocket expense and what that expense is going to be prior to proceeding with the treatment. One of the big things with the iovera treatment is by doing something like this, it doesn't require the narcotic use as much after surgery. Yes, the patient is still going to have, residual post-op pain and may still require narcotics, but what we're finding in the clinic setting is that the patients aren't having to use narcotics as much. And that's a really big factor because narcotics have a ton of side effects. Something simple as nausea, vomiting, to confusion and disorientation. So if we can eliminate the amount of narcotics that the patient needs, they're moving around quicker, and then the potential for complications due to narcotics is substantially less. We don't require a referral. Some patients' insurance companies do, but if a patient wants to know, hey, am I a candidate for this? They can call us, say my knee's hurting. We can then work on the process of getting that patient in to be seen. We can evaluate, and then at that appointment, discuss if they are a candidate for iovera. So Mary has actually been my patient for probably 2 or 3 years. I have seen her prior to her first knee replacement. I've seen her post-operatively. I've seen her in treatment for the other knee. She was one of those patients that we tried about everything we could to see what was going on, why she was still having this residual pain. And she was actually one of the first patients I did iovera on, not really knowing how she was going to respond, how well this was going to work. And she'll be the first to tell you, it has definitely decreased her pain. It's allowed her to be more mobile, be more functional, and kind of get back to the activities that she enjoys.
Hi, I'm Mary Jankowski. I'm 70 years old and I'm in for having treatments on my left knee. I've had it on my right knee post-surgery, and now I'm having it done pre-surgery on my left knee. I was in so much pain after my right knee replacement. Dr. Dickens did all of the testing to decide that nothing was wrong with the replacement, so it had to have been my nerves. So we decided to try this and see if it would work. After I had the treatment, I had no more pain. I'm able to start training dogs again, and I'm no longer crabby.
Do you agree with that?
Yes.
It's not really uncomfortable because they do so much of the freezing of the location, but I wouldn't say it was as painful as the way my knee was before the procedure. My knee was in so much pain, I was basically dragging it, and now I'm able to walk and live a normal life. I have a lot of clients that I work with my dog business, and I have been recommending Dr. Dickens and the procedures and everything highly to them, letting them know that there is a solution to their pain, and Dr. Dickens and his staff are first rate and will address their concerns. When I had the first one done after my right knee replacement and I got off the table and there was no more pain, it's like, oh yeah, let's do this more often. But yeah, it was a miracle.